Okay, so today I'm talking to Ava Mason, who's a PhD candidate and a researcher in the field of mental health. I suppose I'm not sure if that's a precise description. So we'll talk about mental health. Obviously, we'll talk about psychedelics and the role of psychedelics in addressing and treating certain, I guess, mental health issues, which is a very interesting topic. So I was really looking forward to this. So thank you for being here, Ava.
No problem.
When I think about psychedelics, when I was preparing for this conversation, I remembered my own experience a few years ago in London. Is that I think that's where you're based, by the way. Is that
Yeah,
yeah?
yeah, then.
So yeah, a few years back, like I said, I was experimenting with some things in London, and I was this craziest psychedelic trip. And what I took was called salvia, which is when I did some reading on it. I think it's actually the strongest or one of the strongest substances I think naturally occurring on Earth. So that kind of makes sense. What I experienced was absolutely out of this world. But actually, before we start talking about this, and I will share my my crazy trip. But first, I wanted to start with talking about mental health. Mental health research, and mental health issues. So my first thought when I thought about mental health generally, I had nothing to do with it normally, but I thought, and I wonder if you agree with this. Uh, would you say that in everyday discourse, mental health is something that's kind of played down just by the use of certain phrases? Because I thought about phrases, and I think I even said it already just a few minutes ago when I said I had this crazy experience. So that's what I mean. Like when we talk about like crazy things, and you're crazy, or that's crazy, or I'm depressed. When I'm not really depressed. I'm depressed because I'm hungry or whatever.
Mhm.
Do you think that's even do you agree? Is that something that you ever thought about?
Yeah, I think that in this day and age, we are getting an increased awareness of mental health. And I think the more awareness there is into it, the more we realize that we are misusing some terms. And I think, yeah, when you start to become more aware of what terms actually mean, you realize how much you've been using them in daily life and how you haven't considered the importance of what that label might be. So I think in a way, it's slightly a good thing because it shows that we are starting to understand that these words should be used in certain contexts or not. But obviously, after that comes trying to implement, changing the way that we use language and things like that. So yeah, I think
Uh,
at the moment, the increased awareness is making us more understand of like the kind of words that we are using.
Yeah, yeah, it makes sense. I kind of thought about whether it's a good thing or a bad thing, because I thought, it could be a good thing just because when we use these words and then we reflect on that, use of these words, it kind of obviously forces us to reflect on the issue. But then, yeah, on the other hand, I thought, if we overuse it and we don't reflect on it, then it perhaps is dangerous because it kind of becomes normal. Yeah, I'm crazy, you're crazy, he's crazy. I'm depressed today and not tomorrow. So the opposite. Yeah, but
I think
so that's
also, yeah, I think also because we are gaining more awareness into different mental health difficulties and people with these disorders feel like they can talk more about it, especially online, it's also important that young children who are having access to media and virtual, like social media, see these words and don't understand their meaning as well. So I think it's good that we have awareness, but being able to have awareness and also show the difference between, people with a disorder and just, feeling stressed is really important, especially for younger generations who can see all this information but might not fully understand it and might just start picking up on using specific terms without knowing their meaning fully.
yeah, and I think, like you said, nowadays, perhaps one of the few good things about social media and being online and this increasingly online interconnected world is must surely be that, like you said, it's easier to raise awareness, and even in recent years we've heard quite a lot about depression, for example, and obviously famous people, famous actors, celebrities that we know, and we learned that they suffered from depression. So again, I know that mental health is such a broad thing, such a broad field and topic. So what is it that you are perhaps more interested in? Is there such thing? Is there like some narrow aspect of mental health, or what is it that you do?
Yeah, so I'm interested in more personalized treatment for individuals. So a lot of individuals can have multiple mental health disorders at once, and obviously they play off each other in terms of symptoms or in terms of even the treatment, therapy, or medication that people might have. So for me, I'm looking at people with psychosis and have some PTSD symptoms that they may have developed from a childhood trauma, because there's been seen to have a high prevalence of childhood trauma in those with psychosis. And what I was interested in when I started looking into it was, what is the difference between a PTSD flashback and a hallucination from psychosis? Because I thought they're quite similar in terms of what you would consider them to be, but actually there are quite a few differences. But I guess in general, I would say that it's really important to treat people on a personal level and look at their environment, their support system, their, who they're interacting with, their family and friends, as well as, what disorders they may have, what symptoms from a symptom level they might experience, and how they interact with each other. Yeah. So,
Yeah.
yeah.
Uh-huh. And what is you mentioned PTSD flashback and hallucination, or the other way around, psychosis.
Yeah.
Yeah. So what is it? What are these things that you mentioned? I don't know much about. Like I said, I don't even know exactly. Couldn't define psychosis to start with. But then these symptoms that you mentioned. So these
Yeah.
flashbacks, or what is it?
Yeah, sure. So, I'll just talk a little bit about trauma briefly, so you can understand
Uh-huh.
like how you can go from having a traumatic experience to having, PTSD-like symptoms, because obviously a lot of people can experience some sort of trauma in their life, and some people might develop these symptoms and some people might not. And it's basically to do with how we process the memory. So when we experience a highly stressful event, we process memories more in like a detailed sensory aspect, in the amygdala, and less the context in terms
Okay.
of like the spatial temporal context of the memory. So what time it was in, and less the context of it. So because of that, we're more likely to experience flashbacks. So images of the event coming to mind, and especially feeling like it's happening to you at that moment.
Okay.
And that's because the way you process your memory and how detailed and sensory it is makes you feel like you're experiencing that memory again in the here and now, right?
Mm-hmm.
So usually over time, your brain is able to process this memory in the correct way. So you're able to place it more in relation to all the other memories that you've experienced, and it's not as highly emotional. But if you can't do that, then it's easy for different kind of environmental triggers to trigger that memory. So when you have like intrusive experience, it could be a flashback, like an image, or it could be something like a nightmare when you're sleeping. Yeah. And then a hallucination is basically when you can't decipher what is reality and what isn't. So you might interpret a sensory experience as something that's out of your control. So in a way, it's similar to a flashback because you might see something, but a lot of people also have audio hallucination, auditory. So they hear voices and they think that it's happening from someone else.
Okay.
Yeah, so I think it also matters the context. So you may have a hallucination that may have been triggered from a memory, such as if you were abused when you're younger and now you hear voices of someone negatively talking about you, or a flashback, which would be actually remembering that image in your head of that trauma. So obviously there is a lot of overlap between these
Yeah.
two things, and it can be hard to decipher what would be considered a flashback and what would be considered a hallucination, right?
Oh, yeah. Okay. So you can because that was my question. So you said it's hard to decide. Is it because I was wondering if when you have these flashbacks, you mentioned that when you have a hallucination, you can't distinguish, this hallucination from the reality. So I take it that when you have a flashback, you know that it's not happening. But also you mentioned that you may feel like it's happening, but do you actually know it's not happening? Or, is that what distinguishes between these,
Mm,
flashbacks and hallucinations? Or is there no such, clear cut?
I think it's hard
Uh,
because you can
mm,
be aware of a hallucination and you can also be aware that the
oh,
flashback
okay.
isn't real, right? I think it's more, is it related to something that's happened to you in the past or
Oh,
not?
okay.
I think, I mean, it's hard to really give a distinction, but maybe it's clearer. Yeah, and also some people haven't experienced trauma, so obviously, that's when you can more decipher the difference. But I think in terms of PTSD-like symptoms, it usually occurs after a traumatic event, and you've had those symptoms for at least 1 month. So I think it's a bit more obvious from that whether the trauma has caused it or not. But yeah, also I want to say that hallucinations, you can have auditory, so when you hear
Uh-huh.
voices, visual, so when you see things, but you can also have like sensory ones. So
Uh-huh.
you can have ones where you can smell a sense that isn't there. So you might
Yeah.
smell like decay or something, and that's not there. You can also have tactile ones where you feel like something's grabbing
Oh.
you or touching you, and that's not real. So there, hallucinations can happen in all kinds of different ways. It's not just hearing voices or being able to see things.
Yeah, this
Yeah.
is, I admit it can be quite scary to, to think about
Mm.
the extent to which you can have these hallucinations, just like you described. And we will soon talk about psychedelics, and it makes total sense to me to talk about psychedelics in the context of, what we're talking about now, because uh, precisely because you can have this kind of experiences also where your mind, is kind of tricking you into something that's not happening, into believing that something's happening. So this is, I think, the most perplexing aspect of this to me is, how is it possible that you can actually feel something, like you said, or hear something, and I think it's also, it shows how few people, or how little awareness we have, like in every day, the way we function and just live our lives, how little awareness we have of the extent to which our brain determines our experiences, everyday experiences, because it's kind of obvious, everybody knows that our brain is important, but I don't think everybody knows and realizes just how important. Because I have this book, I read this book, it's called "The Man Who Mistook His Wife for a Hat." For,
Yeah.
yeah, and yeah, sounds weird, and it's literally it's a book, it's a collection of different real experiences and stories, people with all kinds of problems, and I think mental health disorders, but usually as a result of some kind of an accident, so some damage. I think it's more about actual damage, brain damage, and all kinds of experiences. I keep wanting to say crazy experiences, but now after what
Oh
we've
no, it's fine.
yeah, after what we've said, it's just I feel guilty whenever I want to
Oh
say.
no, don't worry. I mean, I think a lot of it is in our vocabulary at the moment. You can't
Yeah,
expect yourself to just eliminate it straight away. You know.
yeah, but I'm
Yeah.
working on it, at least for the length of this video. But yeah, but so there is this story. There is literally, one of the chapters. It's about a guy who literally mistook, and like not just once, but it would just regularly happen that he would, casually mistake his wife for a hat. So like, like a normal everyday thing. Oh, it's a
Yeah.
hat. I thought it's my wife. Yeah. So it's unbelievable when you think about it. But then I think it's unbelievable simply because because our brain is functioning the way it's supposed to be functioning, so we cannot even comprehend that situation. But it just shows you how how important it is. I was going to ask you about. Is there such thing as hot topics in mental health? I know there again probably quite a
Yeah.
few things
There's a
that.
lot. I mean,
Mhm.
you'd have to be more specific, but I guess in general, um, in terms of medication, we're trying to see how we can repurpose drugs for people who are treatment resistant to depression, so depressive symptoms. A lot, schizophrenia or psychosis is the same thing. So it's just trying to help those people that fit in that bracket where they've tried everything over the
Okay.
years and they're still not effective. So, like for people with psychosis, about a third of people, or schizophrenia, sorry, about a third of people don't respond to any antipsychotic. and also the side effects of it means that people don't want to stay on it for a long time, right? So that comes with repurposing drugs, so drugs that are being used for one thing, and seeing if that mechanism of action of the drug, the biology of it, relates to the symptoms of a disorder, and also the tests that we're doing in psychedelics and like ketamine for use for treatment-resistant depression, MDMA for PTSD. Obviously, there aren't that many trials being done in some of those things at the moment, but it's just repurposing drugs that might be used recreationally for people who have used all other lines of resources. And then in terms of mental health therapy, I would say that the use of more virtual things, so like phone applications, not just virtual reality, but like, yeah, just more virtual online kind of therapy treatments, because therapy is often not offered to people because of how labor intensive it is for therapists. There aren't enough therapists out there. It costs more money than giving out medication. So being able to have things online so that people can have the same resources but be able to access it from their own home has been seen as one way that we could do that. And also being able to track the mood and the symptoms of patients through these apps as well. So not just to help with in that way. So I think the use of virtual applications and that.
Yeah, I just remembered something I will mention again later, but I just wanted to say to whoever's watching this that you also have a YouTube channel, and some of the things that you mentioned made me remember, because you do talk about, one of the videos is about virtual reality, I think.
Yeah.
Some other videos are about psychedelics as well. This is the video that actually encouraged me to to think about exploring this further with you. But yeah, so I'll link to this channel, because there are just interesting things and interesting insights there. Also, as you were talking about this interest in repurposing drugs, what I find interesting is that I may be wrong, but I think that this has been done before. It was probably as long as 80 years ago or 60 or something. I think in 1940s, 50s maybe. From what I've heard, there were some attempts there was interest in using drugs, especially psychedelics, for treatment, but I don't think it was very encouraged at that point. And I think the people who attempted to do that, their careers were pretty much over and destroyed. And I think again, it's just my impression. I don't know what happened in between, but I have a feeling, an impression that for a long time it was ignored, and then again relatively recently, some researchers decided that perhaps it was not such a bad idea after all.
Yeah, I do think it's partly because now we know how to do a more stricter trial in order to test these drugs. Also, we've tried other options, and we can see that there are still people who are resistant to current treatments. So there's more of a need for it. And I think also, what's it called? Like the stigma of these psychedelics. For instance. A lot of patients won't want to use that, and I think, it's all great making an effective treatment, but if patients don't actually want to consider it, then it's kind of useless. So I think it's always about changing public perception of drugs as well. And it's really hard, because one of the ways that you can change it is by showing that they have good results. But the only way to get those results is to recruit them in the first place, right? So it's that continuous circle. And as society changes their views on certain drugs, that's when it's easier or not easier to test them. But mainly, I think the issue with psychedelics is the legal classification of it means that it's really hard to obtain, even for research purposes. So there are very small lab groups at the moment. I mean, I know of one in King's, but it's just the actual ethical process of retrieving them, because of how they're classified in the UK, means it's really hard to test it and then to have a large enough sample size to show the effectiveness of it. So I think in terms of recreational drugs as a whole, in terms of like ketamine, cannabis, MDMA, psychedelics, the way it's classified seems to be that trickiest one to test.
Yeah, and like you said, I know that ethics of this is important for anyone knowing anything about research. They would know that ethics is always the number one topic. You have to get approval for everyday normal, so to speak, studies. You need to have ethical approval, and for studies like these, or anything that may pose any threat to your participants, that's a real pain, and it's very hard to get such studies approved. And also the ethics, meaning the procedures during the study. I think I read somewhere, I'm not sure who it was. I think the guy was called Leary or something, Larry Leary. I'll probably just put it on the screen if I find it. But there was a guy who tested, I think, LSD in 1960s, and possible, its possible use for treating certain disorders. The problem was he tested it on his students. so that shows you is exactly what you said, that in the past perhaps one of the reasons why it was not welcomed was specifically the researchers who maybe they didn't think through the whole their approach to research. But I also agree that the general public's attitude and beliefs is definitely important. And here again, I think perhaps this kind of answers my question. It's just a theory, I have no idea, but my question of what happened in between that period and nowadays. We had this whole golden age of of drugs and hippies and all that, and perhaps this did not really help this image of drugs, because that's what they are now perceived as, for what they are, drugs. And rather than something that we could even remotely consider to be something possibly good or helpful. But I also think, just my observation, that it's been changing, because just in recent years I've seen so much documentaries and things about psychedelics specifically and their use, and various positive things associated with these drugs. So yes, I think
I think also recreational use of drugs, some certain drugs, you're not sure how pure the drug is, or the dose will be very different to what a clinical trial might have. So people might react differently to it from their own experience of it, because of obviously like exactly what kind of psychedelic they took, or if it's related to cannabis, like what strain they took. And some people will just use that experience, and that might negatively affect what they think about it in terms of a treatment. But obviously, as a treatment, it's such a small dose compared to what you would take recreationally, and it's so much more pure in terms of whatever kind of drug it is. It will, you might react completely differently to that, and it's and I think people also need to understand that as well. So you might recreationally use a drug, but if you took it as a treatment, it might not work as effectively, or might work even more effectively, and there is a difference between that as well.
Yeah. What you said, it definitely makes sense what you said about the different doses. That's because that's something I was going to ask you about, because I was wondering, how can you possibly achieve anything positive, like in terms of, apart from pure fun, for some people, how could you possibly use it to help somebody who's struggling? Because here I need to come back to my experiences, and just wanted to talk about psychedelics themselves a little bit more, and what they do. So again, to come back to my experience, like I said, the thing is called salvia, I believe. I think there is probably like some professional name for it as well, Latin name, but it's called salvia. I think it's some kind of a plant, and I only read about these things a few years after I had this experience. So I'm not sure if do you know what this thing is? Have you heard of?
I've heard of it, but just in terms of its relation.
Yeah. So the thing is called salvia. It's an extremely powerful thing, as I know now. Is as I said, I don't nowadays I don't take any drugs or anything. I mean, depends on I don't perceive weed to be a real drug. Anyway, that thing. So it was a few years back, and we experimented with this thing in London. We came to London with my friends, and the reason I'm talking about it is because we mentioned the role of brain, and how it determines how it can trick you into certain things when you have a certain disorder or brain damage. And of course this happens with these drugs as well, because basically what happened initially, as we tried to as we experimented with this thing, which you can buy in London legally. I don't know how this works and how it's possible. Maybe it's changed by now. I don't know, but you can buy it in shops. So it's not like you have to, go to some weird places and talk to dodgy people. So we tried initially. We would literally we had this pipe and we would just pass it around, just like taking a few puffs each, and what happened usually, everybody experienced this in a completely different way. That's one thing. So like everybody would have some different effects. Like a friend of mine would always feel like there's some barrier, like a shield around him, like he was in some kind of a bubble or something physical. And for me, every time I did it, the first thing I experienced was I felt as if the air thickened from my knees down. So like I felt like I'm standing in water or something, and so I just and I could swear I could feel it. So that's the interesting thing. I could feel the air becoming thick, and then I could touch it. So I would bend and try to touch that air, and again, and I could tell my hand would stop there, and like it was like a jelly or something, like again like touching water, like as if I was knee deep in water. So that that's that was the beginning of it, and that's already weird enough to me, because like I said, I could swear I could feel that barrier, like my hand would stop as I reached that that thing, and so that's obviously it tells you how powerful it is, and that's and that was only the beginnings of it. So obviously and we were young and stupid. I wouldn't recommend this to anyone, just not in such doses, because what happened next was we went to a party, and basically we were in a park in London, and somewhere in central London, which is again not a good idea for any kind of drugs related to hallucinations or psychedelics. So I decided, I wanted to see how powerful this thing can be. So rather than having this one puff, I rolled a joint and I smoked it very fast myself. I just wanted, it hits you very quickly as well, and usually this high, it lasts for like 5 minutes, 10 minutes. So I wanted to make sure that I managed to smoke it before it hits me. And it did, and it started as always. It started with that thick air from my knees down. But then I was completely gone. Like I was absolutely gone after that. And the thing is, I was not in that park at all. It's not like I was there and I saw some things that were not supposed to be there. I did not see that park in the first place at all. Like I did not know where I was, and I was in a completely different world. And this is the fun bit. I wasn't in the world of like huge these inflated boats, like huge what you call it, huge rubber rafts. I was small. I was like the size of an insect. I was sliding down these huge colorful rafts and trying to climb them and sliding back. So it was a completely, again, I have to use the word crazy, because it was a crazy world and experience. I had no idea where I was, and at the same time it felt good. I think that's the whole point of it. And after a few minutes I was back, and when it started to wear off, and gradually I started to see my surroundings, so I started to realize again that I'm in a park. I started to remember that I took this thing, and I felt at that point I felt extremely sad that it's going away, that I'm not there anymore. But after that, and I really loved it. I have to say I loved that experience. But then when it completely wore off, when it stopped, after that, ever since, I never had the courage to do it again. To me it was too much. So the thing that fascinates me about this experience and this insight into how it works, and then obviously everything that I've heard from others, is precisely what I said before, that you can actually believe that you're somewhere where you're not. You can feel things, you can touch things, you can hear things, and you're not there. And this is unbelievable. And I wanted to talk about psychedelics in general. Like, what are they in the first place? Because that's my my own experience, and my the one thing that I know personally from my experience, but I know there are a few, I think, powerful substances that I've heard about. What is that called? Ayahuasca, for example. I don't know if that's.
LSD, magic mushrooms,
Yeah.
psilocybin.
So are
Yeah,
these like all used?
they're all grouped within psychedelics,
Mhm.
drug group, I would say. I think it's hard though because the mechanism of action, why it causes these experiences, is less looked at because, in terms of like a biological point of view, the link with serotonin is massive, and obviously serotonin is more related to, depression and mood, and less to do with the actual why we get this kind of psychedelic experience, and more to do with how we feel during it, and whether if we have more like negative rigid thoughts during that experience, it's easier for them to be more relaxed and then to think more positively and out of the box than we usually would. But it seems to be that it might be because it reduces the activity in some brain regions that integrate information from the outside world. So
Okay.
but not in terms of brain regions that are specific to like visual. So making sure that when you see something with your eye, that's seen as something that's happening from the outside, but more brain regions that are associated with general, like the way we manage all the stimuli around us. And I think there's been some evidence that there is reduced activity in that region when you are high, basically on psychedelics, which means that we're more likely to see things because we can't integrate information in the correct way. So
Yeah.
I think that might be one of the explanations as to why you might get these experiences, but it's not been looked at or it's not been understood completely.
Yeah. It's funny that another thing that I find fascinating about this topic is that increasingly there are more and more people. I'm quite skeptical about this topic in general. So just another thing I
Yeah,
wanted to make clear. I mean, like I said, I'm not gonna lie. I had this amazing experience, but generally, I'm not somebody who supports this idea of like constantly getting high to find the meaning of life. But I
yeah,
do believe people who feel this way, and uh, there are so many people. Like I said, recent years. In recent years, there have been documentaries. There have been quite a few celebrities talking about this, and the funny thing is, I think some researchers or doctors as well say that how to even put it, what happens there is not just simply something that blows your mind, just like messes up with your head for a few minutes or hours, and that's it. People realize things that they did not realize before. They
yeah,
understand things they did not understand. They come up with like singers or like authors of book authors may come up with a novel, or somebody may come up with lyrics for a new song. So it's not just something, like I said, that's just weird and messy, but it actually seems like you can you can, like I said, understand something or see something or reflect on something that in a completely different way. That's why I think people are so optimistic about it, because they the ones who are optimistic about it, they say it really does help you to see like the meaning of life. Like I said, I'm a little bit skeptical about this idea
no,
of
I
like
agree. Yeah,
yeah.
I think that obviously everyone has their own experience and every individual is different. And in terms of treatment with it, it's completely different to like what we're talking about now, which is just individual experiences. And it might not be the same when you're thinking of it on a group level, but yeah, so it's not just about, like you said, the um, how we look at stimuli and how when the actual experience of seeing something, but also how our thought processes change and how we can discover things. And I think that is to do with the increased serotonin when we have the experience, and the reduced activity in the brain region that's associated with fear and negative feelings and negative evaluations of yourself, so the amygdala. And I do think that if you have reduced activity in that, you do have less rigid thoughts, so you're more likely to explore things that
Okay.
maybe you were already thinking of, but you were suppressing because of your, for instance, you always wanted to ride a bike, but then you just felt like you weren't confident enough to do that,
Oh
right? And
yeah.
then if you have reduced activity in that region, you're more likely to feel confident, so you're more likely to want to do those things that you may have already wanted to do, but you were stopping yourself from doing,
Yeah.
right? Or yeah, or just how you see yourself in general, or even an experience that you had, maybe some sort of trauma or a negative experience, and now you're able to see it in a different angle, basically, when you're in this experience, and there do seem to be some long-lasting changes of those thoughts after the experience.
Yeah, so is it? So you mentioned that obviously the doses are different, right? So I mean, like I
Yeah,
said, I
of course.
wouldn't expect anyone to go through, what I went through or some other people that I've heard,
Yeah.
like in the context of treatment. So what are the doses? Like, what's happening? I mean, is this information available in the first place? Because this is something I wanted
Yeah.
to ask. What's happening during that treatment? Like, are you supposed to get high, or is it are the doses are so small that you can't even tell like anything like physically, but maybe in the long run it's supposed to like unblock something in your head? Like, what's the overall approach? Because I don't get it, to be honest. Like, I have no idea how would you approach it. Is it like single,
Yeah.
trips, or is it throughout, like it's more like a
Yeah.
medicine that you take every day? And so, what's
So
the
I think
approach?
at the moment, I can't quote the exact dosage, but
Mm-hmm.
I have some research where I've looked at it beforehand. But it's enough to experience to have a kind of hallucinatory
Mm-hmm.
experience, and you would take it in a like in an environment, a safe environment in the hospital or wherever the research lab. So you wouldn't leave until that experience is over and the drug is
Okay.
worn off.
Mm-hmm.
And in terms of psychedelics, it's only one dose has been in clinical trials. They're only giving you one dose and seeing how you react straight after the experience, how you feel, and then maybe like a few months or a few weeks afterwards. It's not something that has been seen to be taken regularly in clinical trials.
Mm-hmm.
And even though really small doses are being used, but enough to have some sort of experience, but more mild than maybe you would recreationally, the dose is still being understood. They still don't know for sure what dose to give because it's basically based off animal models. So these kind
Mm-hmm.
of drugs are tested first on animals before they're tested on humans to see, how our brain reacts to it, why it does what it does. And obviously, the dose for an animal, for a
Mm.
mouse, is not going to be the same as for
Yeah.
us. So they start with taking really small doses, I think, in clinical trials. I mean, I've never done a clinical trial, so I'm just
My
basing it
dog.
off my knowledge of the research. But yeah, so they start with really small, and then they see, depending on the side effects that patients may feel when they're
Hmm.
in the study, how maybe they should be increased or decreased. But I think I don't know the dose right now, like what's being used currently, but it's
Mm-hmm.
definitely a lot less than what you would experience, but
Yeah.
enough to feel like you are on something,
Mm-hmm.
basically.
Yeah. No, that was one of my questions as well. Whether it would be something to like take home, take home with you and
Yeah,
then do it, or in an actual clinical setting where you'd be, in a hospital. I mean, it makes sense. I did think it would probably be this one. So that was one of
yeah,
my questions. Yeah, and the other one, I guess. I mean, it's kind of. I think you answered that question. Just to double check, because that was something I wondered about before our chat, whether like where is the actual, like what is the moment of the actual treatment, meaning what I mean here is whether you are supposed to, let's during that experience when you take these things, are you is that the treatment where hopefully you're going to experience something is going to change, you're going to understand something or forget about something, and then you are, well, like treated and healed, so to speak? I know it's not that simple, but
yeah.
is that the moment where during the actual, like I said, the actual high, or is it supposed to be something that, again, if taken maybe regularly, it's supposed to somehow change your like overall, uh, I don't know,
Yeah.
approach to life or something? Is that, I mean, unless there is no such distinction, but I just wondered whether, like, what's, I just
I
find
think
it
it's
hard.
hard because some studies are looking at just having the drug once and that
Mm-hmm.
changing your viewpoint or your symptoms. Because obviously in clinical trials, it's less about what your thought processes are and it's more about like symptom questionnaires and seeing how your symptoms change, right? Which might not reflect exactly like what you would consider to be important. But anyway, that's what's being measured usually for clinical trials. So some of them you're just taking one dose and you're seeing how your symptoms have changed over time just from that one dose. And other studies are doing it in combination with therapy. So it's
Mm-hmm.
seeing whether it increases your ability to change your thought processes when you have therapy. So I'm assuming that if that option was going to be taken, I don't know if they would just give you one dose and then you'd have therapy, or if you'd have a
Mm.
dose every time you had a session,
Mm.
and maybe because it'll be easier for you to relax those rigid thought processes and you might be more suggestible to what the therapist is saying to you.
Mm-hmm.
But obviously, this is like not really been tested that much. There's only been about 2 or 3 trials that have looked into this. And the reason why also they use it with therapy is because, in terms of ethical considerations, they want to make sure that those participants are getting the best therapy they can. So, for instance, beforehand, they might have been already on therapy and they might want to continue that, and it would be unethical to then put them on a completely different
Mm.
treatment, such as testing this. So they think we have to give them the most optimal treatment option ever and keep them on the therapy and see how it interacts with the drug. So yeah, I think it's a really good question, but I don't think enough research really can tell whether this would be a one dose and then see that it changes your whole life,
Mm.
or whether it would be something that would be taken over time in a good environment.
Yeah. So overall, do you think we kind of talked about it, but do you think there is this increase in interest and maybe acceptance towards
I
these?
think, yeah, I think it's hard. I think in terms of the research, in terms of researchers, I think that it's still a long way to go. There's only been a few trials, and because it's so hard to actually obtain these drugs for clinical
Mm.
trial, it puts a lot of researchers off even trying to do it.
Yeah.
And they're probably more likely to be more interested in other kinds of, even other kind of recreational drugs,
Mm.
which aren't legally classified how they are in such a serious category.
Mm.
Um, in terms of, but obviously that goes with public perception. If public perception of the drug, people think that it might be a good treatment and they're more likely to do it, then there'll be more of a reason to, do more clinical trials. So I think they do come hand in hand to a certain extent, and obviously financially for like pharmaceutical companies, which obviously just care about how much money they can make off the
Yeah.
drug, and that kind of concept. Obviously, if society is more susceptible to taking psychedelic over something else that's being in clinical trials, then maybe there'll be more funding for it. And with more funding means it's easier to obtain it for clinical trials because
Mm.
pharmaceutical companies care about it. So there's a lot of things at play in terms of society, ethical considerations like legal, pharmacy. But I think at the moment there's still a long way to go.
Yeah, because I wondered. I mean, one thing is, I think that probably what helps at least a little bit is the current situation regarding cannabis, where
Yeah.
it's definitely been, the perception's been changing, and we can see, like what's happening in the States, and I'm pretty sure it's going to happen here in the UK as well. So I think this may contribute just a little bit, at least a little bit,
Yeah, a
to
tiny
this
bit.
whole perception. And so I suppose from the perspective of a novice researcher or somebody interested in it, is it something? I guess I just thought about what somebody may be wondering about watching this video. I understand that it's hard, and I understand it's hard to get approval. But is it even possible? Is it even a thing for for somebody who wants to who finds interest in this topic, somebody who's just starting, his or her journey and is studying, for example, or doing research, or maybe right after, graduation, wants to, go, just, that down that road. Is it even possible? Is it even legal? Is there any
Yeah.
possibility, or is it just not very common but still possible, or is it virtually impossible to even think about it? I wonder if.
I think it is possible. I
Mhm.
think that, I mean, I only know from the universities I've been to, so King's and UCL, the lab groups that there are. So King's has a lab group that look at psychedelics, and I know that they have done some clinical trials with it. And obviously during my master's there, we learnt about it as a possible treatment, and that's how I know that the lab group exists.
Mhm.
I don't think there will be as many lab groups that you can kind of do, your master's or whatever kind of research with. I don't know how many lab groups there actually are with psychedelics in terms of all the universities in the UK or whatever, but they do exist.
Yeah.
And I think UCL as well. I don't know if they have a lab group, but a lot of the masters now, in terms of mental health masters, are teaching about ketamine,
Mm.
psychedelics, recreational drug use as in terms of clinical trials, and they wouldn't be teaching us those interventions if they didn't see that there is a
Yeah.
possibility of more research being put into it, and also they wouldn't tell us about it if there weren't some sort of research being done in their own institutions. So I think that there'll be less researchers, but it's still possible. And yeah, I do think it is possible to get into.
Yeah, definitely. If you mentioned there are lab groups, that's, I guess,
Well,
the good news for anyone thinking about it, because otherwise there just simply wouldn't be, they'll be hiding somewhere in basements,
Exactly.
taking drugs. So yeah, I think that's all. So again, just wanted to remind everyone about your channel, and I will link to it. There are really interesting videos there, and thank you again for taking the time to talk to me.
No
It was
problem.
really insightful and interesting.
Thanks.